Here is an ASEAN Excellence in Pre-Hospital Injury Care Traumatic Brain Injury course. The section topic today is Evaluation and Documentation of Vital Signs and Mental Status. We have 3 learning objectives here. First, beware of normal ranges of vital signs and mental status. Second, be able to measure and evaluate vital signs and mental status. And third, be able to record vital signs and mental status. First, we have to give course disclosures. These course contents were from EPIC TBI project of Arizona and has been modified by ASEAN EMS Council. Faculty here has no financial interest or other relationships with manufacturers of any products and providers of the service related to these course contents. First objective, we have to know the normal range of blood pressure. The normal range of blood pressure in adult was 120/80 mmHg, and in the infant is 70 mmHg. In the preschool age is around 80, and in the school age is around 90. For all patients with traumatic brain injury, please keep the blood pressures higher than 90 mmHg. Here we have a demonstration to show you how to check the blood pressure. Place the patient sitting or spine. Locate the arm at the level of the heart. Wrap the cuff around the patient's upper arm. Check his or her bronchial artery. Then inflate the cuff. Inflate the cuff until the pressure is higher than 180 plus 30s, that means 220. Release the valve at the speed of 5 to 10 mmHg pressure drop per second. As the pressure drop, use the stethoscope to listen for a throbbing or knocking sound. When you hear the first thump, make a note of systolic blood pressures on the gauge. Keep watching the gauge. Eventually, the heart throbbing noises will turn into a whooshing sound. As soon as the whooshing noise subsides and you hear only silence, make a note of the diastolic blood pressures on the gauge. We have 3 ways to measure the respiration: to see the chest wall movement, to see the depth of respirations, is shallow or deep, and to count the rate of respiration. We also have to know the normal range of respiration. For adult, it's 10 breaths per minute. For infant, it's 25. For children, it's 20. And for older adolescent, it's 10, just as the adult. If you have end-tidal CO2, and then you can titrate your end-tidal CO2 level to 40 for the patient with severe brain injury. There are 4 parts we can check the pulsation: in the carotid artery, in the bronchial artery of a baby, in the radial artery, and in the femoral artery in the spine position patient. In hypovolemic status, carotid pressures can be palpated in at least 60 mmHg pressure, and femoral artery can be palpated in at least 70 mmHg pressure. and radial artery can be palpated in at least 80 mmHg pressure. And this surrogate point check can be used in the emergency check of the blood pressure in case you don't have the blood pressure cuff at hand. And we also have to know the normal range of pulse rate. The normal range of pulse rates in adult is 60 to 100 beats per minute. For infant, it's 80 to 110 beats per minute. And for children, it's 60 to 110 beats per minute. Less than 80 beats per minute is defined as bradycardia in infants, and less than 60 beats per minute is defined as arrest in infant. Please note it. And we have to use the oxygen oximeter to check the oxygen saturation. Like this, use in your fingers. The normal range of oxygen saturation is 95 to 99%. And when it comes to the 91 to 94%, it is called mild hypoxia. And less than 90% is moderate hypoxia. And less than 85% is severe hypoxia. Finally, let's get to the check of mental status. The basic level of mental status can be categorized into AVPU, A, alert, aware, V, verbal, and responsive to verbal call, P, PAN, responsive to PAN, stimulation, and U, unresponsive to anything. We also have a more accurate mental status measurement called Glasgow Coma Scale Scoring that we have taught in the previous knowledge lecture. In the new editions of Glasgow Coma Scale, we have another item called NT, means non-testable, if the patient cannot be tested in that kind of domain. Remember to measure the blood pressure and position in kid on the bronchial artery in the infants and the radial artery in children. Pulse rate is affected by respiration rate, thus it is important. Checking pulse in kid should spend 1 minute. So this is important things to check the respiration in kids. First, use oscillations to see the breathing sounds and inspect the chest wall movement. And second, remember to check for 1 minute. And third, if the kids have a nasal flaring or paradoxical chest wall movement or depressed thoracic cage, it means the kids have abnormal respiration. And this is the modified Glasgow Coma Scale for preventable children that we have already taught in previous knowledge sections. For example, if a baby is spontaneously eye-opening with irritable crying and can withdraw from touch, then the patient's Glasgow Coma Scale is E4, V4, and M5 in the children. This is the final message. Remember to check 5 things and document 5 things every 5 minutes or more frequently in case a patient is in deterioration. The first, vital sign, including blood pressure, pulse, respiration rate. And the second, oxygen saturation and entitled CO2 if the patient is intubated. And third, Glasgow Coma Scale, a specially accurate motor scale. And 4, pupil size and light refraction. And 5, fluid givens at transfer of care. Thank you.